Over the years, many hearings in the House and Senate have produced tension-filled moments and sometimes important policy changes. Here are some of the most memorable. In an effort to build support for President Bill Clinton's health plan, the First Lady testified before 5 separate committees on Capitol Hill. Most of the interactions were polite, but Republicans made it clear they were not buying what she was selling.
And while I don't share the chairman's joy at our holding hearings on a government-run health care system, I do share his intention to make the debate and the legislative process as exciting as possible.
I'm sure you will do that, Mr. Army.
We'll do the best we can.
You and Dr. Kevorkian, I think, right?
I have been told about your charm and wit, and let me say, the reports on your charm are overstated and the reports on your wit are understated.
Thank you very much.
As part of an investigation into the dangers of smoking, the CEOs of the nation's top tobacco companies testified under oath before the House Energy and Commerce Committee. Oregon Congressman, now Senator Ron Wyden, famously drilled the executives about a key point.
Yes or no? Do you believe nicotine is not addictive?
I believe nicotine is not addictive, yes.
Mr. Johnston.
Congressman, cigarettes and nicotine clearly do not meet the classic definitions of addiction. There is no intoxication.
We'll take that as a no. And again, time is short. If you could just, I think each of you believe nicotine is not addictive. We just would like to have this for the record.
I don't believe that nicotine or our products are addictive.
I believe nicotine is not addictive.
I believe that nicotine is not addictive.
I believe that nicotine is not addictive.
And I, too, believe that nicotine is not addictive.
The launch of healthcare.gov, which was supposed to let people sign up for insurance under the new Affordable Care Act, did not go as planned. Health and Human Services Secretary Kathleen Sebelius was summoned to explain the mishap to members of Congress.
Frustrated and angry as anyone with the flawed launch of healthcare.gov.
So who is responsible for overseeing this project? Is it you or your designee?
Hold me accountable for the debacle.
Okay.
I'm responsible.
Dramatic price increases on drugs that had been on the market for years caught the attention of Congress. The poster child for buying up old drugs and raising prices was Martin Shkreli, who was later convicted of fraud. Here he is at the House Government Reform and Oversight Committee.
What do you say to that single pregnant woman who might have AIDS, no income, and she needs Daraprim in order to survive? What do you say to her when she has to make that choice? What do you say to her?
On the advice of counsel, I invoke my Fifth Amendment privilege against self-incrimination and respectfully decline to answer your question.
Republican efforts to repeal and replace the Affordable Care Act prompted some major protests, particularly from people with disabilities who worried about the potential loss of their Medicaid health coverage. The protests came to a head at a hearing of the Senate Finance Committee.